Bexa is a revolutionary device that scans breast tissue for abnormalities with no pain, no radiation, and immediate results. Bexa's proprietary high-resolution capacitive sensor array is driven by the same technology that runs the touchscreen on your mobile phone. It scans through the individual elements in the sensor array tens of thousands of times a second, each time acquiring discrete data about the response pressures of the tissue underneath the sensor array when it's being pressed into the breast. Each time acquiring discrete data about the response pressures of the tissue underneath the sensor array when it's being pressed into the breast. This allows the creation of a very high-resolution and accurate elastographic image based on the elasticity of the tissue underneath, as opposed to the density. Bexa provides two different views of the pressure data from the tissue. The mesh view visualizes the pressures based on height and by color. It makes it easy for the examiners to find different shapes and items of greater hardness while the sensor is moving across the skin. The other view is a top-down view that shows the changes in hardness over the area. This is excellent for determining how well-defined a particular mass may be. The image that Bexa produces is a top-down view of all of the tissues stacked up underneath the Bexa sensor array. This is different from ultrasound, in which a very narrow beam goes down and looks at a cross-section of the tissue. This allows ultrasound to be very good at characterizing what has been found underneath the surface of the skin, whereas Bexa's wide field of view makes it very well suited for finding potentially abnormal masses. Once a mass has been localized using the Bexa device, focused ultrasound is performed in order to better characterize the mass. This provides every client who receives an ultrasound a report by a fellowship-trained breast radiologist. This report contains common clinical language that every physician is familiar with, explaining the classification of the mass finding according to the BIRADS classification. BIRADS stands for Breast Imaging Reporting and Data System. The code indicates the likelihood of cancer from normal to highly suspicious, and each category includes recommendations for follow-up care. The BIRADS categories range from 0 to 6. BIRADS 0 studies are incomplete, and more information is needed to make a determination for clinical follow-up. BIRADS 1 and 2 indicate no finding or a benign study, and either routine annual or biannual follow-up is recommended based on assessment of personal breast cancer risk. BIRADS 3, 4, or 5 indicate that additional follow-up is recommended, and these clients are referred into the common diagnostic pathway for clinical evaluation. Because Bexa is not processed for monitoring biopsy malignancy, BIRADS 6, representing known malignancy, is rarely seen.